Picture this. You are using your phone or reading a book when you suddenly feel a sharp electric pain and numbness shooting down your arm, and you have also been experiencing neck aches. You are unable to hold your phone or book up for long. It gets worse when you try to turn your head. You find temporary relief, but the pain keeps coming back. Hello, my name is Dr. Reuben Soh. I am a spine surgeon, and today I would like to tell you a little more about pinched nerves in the spine. With me here is my patient Lucy, who has a condition in her cervical spine. Good morning, Lucy.
Good morning.
Would you be able to tell me a little bit more about what is troubling you?
I'm still having distinct pain right down my arm as well as numbness, and it bothers me a lot.
So what you are experiencing with the pain coming from here down to here is known as cervical radiculopathy.
Cervical
Radiculopathy. That's right.
What's the cause of this, and what is this?
So cervical radiculopathy is a condition where the nerves in your neck are compressed. In our neck, there are nerves that come out from the spine called the cervical spine, and the cervical spine will have these nerves that will come down your arm and go into your hand. So if the nerves up here are compressed and pinched, then there will be some pain and discomfort coming down your arm and into your forearm and into your hand, and you may experience pain, numbness or weakness. And so I will explain to you your MRI results. So this is the front of your spine and this is the back of your spine, and this is actually your spinal cord. And this spinal cord is grey in colour. You can see here there's white in front and behind of the spinal cord, which is the water cushioning in your spinal cord. This is absent here and here because of the compression from the disc, which is a disc prolapse, or what we call a slip disc, as well as some of this bone has grown out here, which we'll just call them as bone spurs. When this happens, there is pinching of the nerve of the cervical spine, and this results in cervical radiculopathy. This could also cause compression of the spinal cord that can result in a condition called cervical myelopathy. Patients with this condition have additional symptoms of clumsiness in their hands.
So what are my treatment options?
I would recommend a surgical procedure called an Anterior Cervical Discectomy and Fusion, ACDF for short. So the aim of this surgery is to create space for your nerve. So what happens is that right now this is your neck bones, this is the front of the spine, and this is the back of the spine. And so there are two important tubes here. One is your windpipe and one is your foot pipe. And so what we are going to do during the surgery is to remove this disc together with the disc and the bone spur that is causing the compression. I'll proceed to illustrate this with a diagram. So there is a slip disc here, or what we call a disc prolapse, as well as bone spurs here, which are causing the nerve compression. And so what we are going to do is to remove them during surgery by going from the front of your spine and this way here. So after we have removed it, the nerves are now free, and that will allow you to get relief of your symptoms. But we need to place a interbody spacer, and this interbody spacer will need to be secured with screws or a plate, and this will then allow the nerves to continue to be free, while over the duration of 6 months to a year, there will be bone growth across the region from this bone to this bone, and this is the fusion.
So doctor, what are the risks associated with this surgery?
Okay, so there are two risks in this surgery. One is a general risk and one is a specific risk. So general risks like infection and bleeding is less than 1%. The specific risks I think most patients are concerned about is injury to the nerve and paralysis. So the risk of this is less than 1%. And that means that there can be some swelling of the foot pipe and the windpipe after the operation, which is then experienced by the patient by having a bit of difficulty swallowing and a bit of change in the quality of their voice, maybe a bit more hoarse, and also the tone of their voice may change slightly. This is often temporary for the first 1 to 2 weeks. Then once the swelling that's associated with the surgery disappears, then the patient's voice returns to normal, their swallowing also returns to normal.
So how do I prepare for the surgery? What do I need to do?
You've already done many of the things already. You've done an X-ray, you've done an MRI scan which looks at the nerves, and you've done a CT scan. So the next thing that we will need to do is we will have the anaesthetist to assess you before the surgery, and that will be done at the pre-admission testing center. And of course, they will give you more instructions there on what needs to be done, fasting before surgery, and also if there's any special medication that you need to take before the surgery. On the day of surgery, you will report to the same day admission center where a pre-operative assessment will be done. The surgery will approximately take 2 hours. After surgery, you will be admitted to the orthopedic short stay ward, general ward, or high dependency ward depending on your condition after surgery, where you will be monitored overnight. Occasionally, a cervical collar will be provided to you to use for comfort. The surgical team will review you in the ward after surgery. Pain and difficulty swallowing is usually temporary and will resolve in a couple of days. A soft diet or clear feeds is usually recommended for 1 to 2 weeks after ACDF surgery. Pain medications will be provided to you post-surgery to help minimize your discomfort.
How long do I need to stay in the hospital after the surgery?
Well, most of our patients only stay for about 24 hours after the spine surgery. Generally, what will happen is on the day that you report for surgery, you have your operation that morning, and in that same day, the physiotherapist will be able to see you and assess you for walking stability, and then they will allow you to go back home that same day or the next morning. If you experience the following symptoms after leaving the hospital, please seek medical advice. Redness or discharge from the wound or fever may signal an infection. Persistent bleeding from the wound, difficulty in breathing.
Thank you, doctor, for the detailed explanation. I'm now more mentally prepared.
You're most welcome. And once again, if you have any concerns, please reach out to me or to my healthcare team, and we'll be able to answer any of your questions.